Left ventricular function plays an important role in the rate at which DEFINITY should be administered. Poor left ventricular function, or a very low heart rate, may require a more rapid administration rate to allow the microbubbles to completely fill from the base of the left ventricle to the apex, where a high heart rate may require a decreased rate of administration. Let's look at how the rate in which DEFINITY is administered can affect image quality. Here is an example of an ideal administration rate. A nice homogeneous fill of the entire left ventricular cavity is achieved. When the administration rate is too fast, a high concentration of microbubbles can enter the left ventricle too quickly, causing a dark shadow to appear that obliterates the entire lower portion of the cardiac structures, as seen in this apical four-chamber view. Attenuation is typically rare with continuous infusion dosing. However, to correct for this artifact, simply decrease the administration rate. When the administration rate is too slow or the ultrasound system settings are not properly adjusted, such as a high mechanical index or incorrect focal zone placement, an insufficient concentration of microbubbles causing an inadequate opacification pattern may occur. This is known as microbubble swirling. Patients with poor left ventricular function and very low blood flow states typically cause swirling, which often requires an increase in administration rate to ensure the concentration of microbubbles reach the apex. Increasing the administration rate and/or decreasing the mechanical index or repositioning the focus may assist in avoiding a swirling artifact.
Let's review the important safety information for DEFINITY. DEFINITY Vial 4 Perfluorine Lipid Microsphere Injectable Suspension. Indications: Activated DEFINITY Perfluorine Lipid Microsphere Injectable Suspension is indicated for use in patients with suboptimal echocardiograms to opacify the left ventricular chamber and to improve the delineation of the left ventricular endocardial border. Contraindications: Do not administer DEFINITY to patients with known or suspected hypersensitivity to perfluorine lipid microsphere or its components, such as polyethylene glycol, PEG. Important safety information. Warning: Serious cardiopulmonary reactions, including fatalities, have occurred uncommonly during or following perfluorine-containing microsphere administration. See Warnings and Precautions 5.1. Most serious reactions occur within 30 minutes of administration. Assess all patients for the presence of any condition that precludes DEFINITY administration. See Contraindications 4. Always have resuscitation equipment and trained personnel readily available. In post-marketing use, rare but serious cardiopulmonary or hypersensitivity reactions have been reported during or shortly following perfluorine and PEG-containing microsphere administration. See Adverse Reactions 6. The risk for these reactions may be increased among patients with unstable cardiopulmonary conditions and/or with pre-existing PEG hypersensitivity. See Adverse Reactions 6.2. It is not always possible to reliably establish a causal relationship to drug exposure due to the presence of underlying conditions. Please see full prescribing information, including boxed warning, regarding serious cardiopulmonary reactions. Full prescribing information is available at DefinityImaging.com from a Lantheus sales representative or by contacting Lantheus customer service at 1-800-299-3431.